Hello, I'm Zeshan Ahmed and I'm a primary care pharmacist at NHS West London Clinical Commissioning Group. When it comes to managing your AF, there may be several medicines that will be prescribed to you. The choice of medication that will be prescribed will depend on various factors and on your individual case. The overall goal of your treatment would be to prevent stroke and to alleviate your symptoms. We can break down the type of medications that you may be prescribed to control your AF depending on their actions and their purpose. Now, when it comes to controlling your symptoms, there are two approaches that may be used. The first is to either control the heart rate or to control the heart rhythm. Generally speaking, for most people, the first line strategy is to control the heart rate. When it comes to controlling the heart rate, there are several medicines that may be prescribed. These may be prescribed either as a single medicine in isolation or a combination, depending on your associated health conditions and your individual case. Examples of medications that may be used to control the heart rate can be things like beta blockers, calcium channel blockers, and digoxin. Beta blockers are quite commonly used. The most common side effects that you may find when taking a beta blocker are things like fatigue, feeling quite tired, coldness of your extremities, and sometimes sleep disturbances. In those patients who perhaps aren't suitable to take a beta blocker, we can also use medications called calcium channel blockers. Common side effects of calcium channel blockers can include swelling of the ankles, flushing, and headaches. Another medication that can be used to control heart rate, which has been around for a very long time, is digoxin. It's quite well established. However, digoxin works best in patients who are quite sedentary and not so active, and therefore is reserved for those cohorts of patients. The common side effects of digoxin can include visual disturbances, nausea, and dizziness. The other option available to us is rhythm control. Rhythm control can be used instead of rate control in those patients for whom either rate control has not worked or not been tolerated very well, or for those patients who seem to have a reversible cause to their atrial fibrillation, and that could be, for example, from an infection, or if their atrial fibrillation is caused by heart failure. When it comes to rhythm control, treatment options can include medications such as amiodarone and also beta blockers. We've discussed beta blockers previously, so let's focus on amiodarone. Amiodarone works in a number of ways to reduce the heart rate. Amiodarone is associated with a number of side effects. Notably, the side effects can include effects on the lungs, on the liver, can cause thyroid abnormalities, side effects to the heart, and also to the skin. When it comes to skin, amiodarone can sensitize the skin to light, so it's important to avoid direct sunlight when you're taking amiodarone. It's also important to notify your healthcare professional if you have any signs of breathlessness, cough, jaundice, tiredness, or weight loss.